And I thought I'd have a hard time with all this. 10 seconds, here we go. Hey, Facebook. Okay, 3 seconds. And good Thursday morning, or Merry Christmas Eve. It's 2 minutes past 10 o'clock, and we're up to 52 degrees at Payson Airport right now. This morning on Community Spotlight on KRIM, we're talking once again with Dr. Judy Hunt, and with her in the studio, a name you may not have heard before, but you probably will be hearing more of, and that is Allison Alchevy, right? Got it right? All right, and now let's start off with just helping to introduce Allison to the community a little bit more. Allison was one of the medical students that you had working over at the clinic here.
She's one of our PA students that we had for her longitudinal program up here in Payson.
Right.
And she liked us.
Wow, she actually liked us.
She liked us. And she, not only did she have an amazing training up here, but she also, because she lived in the community, was able to really get to know Payson.
Mm-hmm.
And the rest is history.
Mm-hmm. Okay. But then you got out of school and now you're actually working up here.
I am working, yes.
So you really did like them.
Yeah, enough to come back.
Yeah, it's Payson were you raised in a small town or?
No, I'm from Phoenix.
Okay, so, and likewise, I was born and raised in Phoenix, and it's kind of, when you first, get your feet in the water here in Payson, it's kind of unusual, and that I didn't really know what to expect, but man, I've been addicted to it for 40 years. It's a great place to be.
Yeah, it is. I actually hadn't been up to Payson until PA school brought me up here for my program.
Right.
So, and yeah, I love it. I love that the room is so close.
And now, and what you're doing up here is kind of the topic that we're going to be discussing today, and
yes.
It's certainly, I think, near and dear to a lot of us, is the whole COVID-19 situation. It's, it pulls our medical professionals here from a lot of different angles, and I'm sure it's, quite taxing, to say the least. That's probably my biggest understatement of the year. So what exactly is your title now, or what is it you're doing?
So I'm a physician assistant.
Right.
And I'm overseeing, I don't know, when I tell patients, I just say I'm doing the COVID stuff at the office.
Right. Oh yeah,
it's
the
not
COVID
like the
stuff,
nicest
yeah.
way to say
Yeah.
it, but I'm overseeing the vaccines
right.
and all the testing and the treatment for
right.
COVID. So anybody that's been exposed or is having symptoms comes to me
Mm-hmm.
for testing and going from there.
Cool.
So it ends up being a visit, whereas previously it was kind of just they needed to be tested, but it wasn't a provider visit.
Right.
They just knew if they were positive or negative.
Did I hear correctly that some of the testing being done now is a little different than it was at the very beginning of all of this, as far as having to stick the swab back in your schnoz a long ways and all that?
It's still a nasopharyngeal swab.
Oh,
That's what
okay.
I'm doing, at least. I think the home tests are able to be just in the nasal
Right.
cavity right there.
But you really got to
Still.
get back in there a little bit to get the real stuff.
That's what I do, yeah.
So stuff is a good word.
And we're still seeing a fair amount of positives on the home tests, so
Yeah.
that's a good sign.
And Judy, you have, and I have spoken a number of times about what this is like for our medical professionals up here. I mean, this last 2 years has really, here's another understatement, it's really been a drag.
Yeah, that's an understatement, Randy.
I'm not sure what the right word is, but I'm not sure I can say it on the radio if I guess it right.
I think everybody who goes into medicine has a heart for service.
Sure.
And for many of us, this is our ministry. It's not just, a job.
Right.
I think the hardest part of it is watching people that we love
Mm-hmm.
hurt and suffer.
See, that's the part that I think a lot of people might not, quickly wrap their brain around, but especially in a small market like this, you end up really knowing your patients, and you bump into them out at restaurants or at the grocery store and things like this. And so it's not just someone that comes in, from 9 to 9:30 next Tuesday or something. It's people that their home life, their families, and all that. It's got to make this extra difficult.
It is. I mean, flip side is a privilege and it's an honor to take care of the people we love.
Yeah.
There is some data, some research that's looking at is the physicians who do not know their patients actually are transiting with less burnout than the physicians who do know their patients.
Right.
Just because of the cost it is, and remaining emotionally engaged.
Right.
It's a lot easier to be a doctor and keep those walls up and not have that engagement on those levels. But the other side of it, again, these are my neighbors, these are my patients, they're people I've known for 25, 26 years.
Right.
And so the discussions, in some ways are harder because I know what it looks like to see my friends die of COVID, and I don't want that to happen. There's a couple of weeks ago where I started crying in the room when a patient told me that she was thinking about now taking it, and it wasn't just crying for her. It was just like it was a cumulative of just crying because I could not think about that this may be the time I say goodbye to her.
Right.
So it's so many different emotions and levels, and I just praise God that we all have some strong support. We have a medical community that loves each other. We like each other, and so we have been doing the best at getting us support. But there's times when it's really lonely.
It's got to be overwhelming, especially like you say when you see people that you know that are passing away. I know this is the first time in my life that I can remember a single thing like this causing. It's been over a dozen different people that I knew personally that have passed away from COVID. So I mean the reality of it, it definitely been slapping me around a little bit. But you know is it true what we're hearing? Well, first of all, let me back up. One of the things that we like to try to do here is stand in the gap because the major media really hasn't been our friend when it comes to this and some other issues like this, in my opinion, as far as getting really factual information out in front of everyone. Is it true right now that the majority of, if not all of the patients that are contracting COVID-19 are unvaccinated?
Yeah, just anecdotally,
Yeah.
in my experience so far, the majority are not vaccinated.
And you know, as being on the front line and seeing this stuff come in, that's got to be something that you probably want to scream about once in a while.
There is, because of the suffering.
Right.
The patients are drowning, and to
Slowly.
have nothing to do to help them is, I think, the hardest thing as a physician, because we're trained to want to help. There's got to be something we can look to help, and reality is that once that cycle begins, and that the storm of all these nasties that get released with the cytokine storm, once that's stopped, it's a train that's barreling. There's no way to stop that process. And even with our support and everything that we have, very few people get off of a ventilator.
Right.
And so that question and that discussion before going on a ventilator is really, this is the time to say goodbye to your family, because we may not be able to have that time again. But can I tell you something cool?
Oh, I'm ready for something cool.
Okay, so Allison, and then we also hired Rebecca, who's another PA student that trained up here last year. So it actually worked. Our training program is beginning to work. But having them, and then also having our medical students and our other students, have really contributed to the health of the medical staff, because they're so excited about being in medicine, as they should be. And it reminds me and all of us that maybe we're old and cynical now, and we have to be role models, and so God's had to change us because we want to make sure that they have the best training and the best exposure and as possible.
Right.
But their enthusiasm and Allison's compassion in dealing with COVID patients all day long is extraordinary, absolutely extraordinary.
Outstanding.
Well, thank you.
That's pretty high praise coming from somebody whose opinion I really respect.
I appreciate it, Dr. Hunt.
You know, excuse me, one of the things that Judy was in here earlier this week, and we talked, and one of the things that I thought was really unusual was I had a recent stint in the ER over here at Banner Basin Medical Center, where I was there for about 8 hours, and I was astounded by the overload of need there. There's people on gurneys out in the hallways, and I mean, there was just a lot of people, and primarily, it looked like a whole lot of it was COVID-related stuff. There was a couple of car accidents too, but other than that, it was mostly breathing-related problems. And I thought that you know, I've known that ER for a lot of years, and I thought this was like the most amazing overload I had witnessed. So I thought it was something really unusual. And Dr. Hump, when I mentioned it to you, you're like, it's not that way all the time right now.
Mm-hmm.
You know, that's
Sure is.
that's weird. And then earlier this week too, Yavapai County came out with a press release talking about how the medical center over there had to order up a new mobile morgue, refrigerated morgue, because they were running out of refrigerated space for bodies. And that, I mean, that's a very telling sign as well. But that's really the reality of where we're at right now.
It is, and I think what's cool about Allison's position is she's on the front line of keeping people out of the hospital.
Right.
And keeping them out of the ER. And so with, ask her about the treatment programs that she administers every day.
So quite a number.
Let's see, I think on average I'm treating anywhere from, we'll say, 7 to 11 people
Wow.
a day.
Now, so help me wrap my wee little mind around this. Now, when we talk about treatment programs, if I come to you and I test positive, and this is you know, early in the whole game, there are the monoclonal antibodies and different things like that that can be done early on, right?
Yes, so.
And is that part of this treatment process that we're talking about?
Yes, the monoclonal antibodies.
Right.
So I offer it to patients that, so I would know more about you, right, if you were my patient. So if you were over 65, or if you're not over 65, if you have a BMI over 25, and if that's not the case either, then what chronic health problems do you have?
Right.
That helps me assess your qualifications for the treatment. And so then I would offer it to you. So it's for treatment of mild to moderate COVID within 10 days of symptom onset. There's a couple other criteria that you have to meet, but ultimately, so what I tell patients is that these 2 medications bind to the spike protein to stop it from replicating in your body any further. So that's how it reduces the viral load, reduces the duration of the illness, and the risk of it turning to a severe infection in those that are considered high risk.
Right. And then once people go through that process, then they have kind of at least somewhat of a built-in immunity at that point from contracting it again, correct? Somewhat.
I don't even know if we really know yet. Possibly at least a month, we'll say.
Right.
I know that they recommend not getting the vaccine if
Right.
People change their mind about getting it. You have to wait 90 days after the treatment. But I think offering the antibody response after this treatment, I'm going to say at least 1 month, 1 to 3 months.
Okay. Now, I'm going to assume that there's at least somebody out there that is as skeptical as I am about the stuff that I've seen in the media lately. But Dr. Hunt, when it comes to the you know, vaccines and all of this, and now they're saying, you know, the booster shot's important too. I mean, you're on the front line, you're seeing this stuff all the time. What's your opinion as far as the importance of a booster if you've already been?
I would be in line every day, Randy, if I could, just in watching my patients die. I would say if I have to get this every day, I would. The booster is going to kind of solidify the immune system against COVID. And we saw that the first 2 shots kind of made it so that we had a foundational immunity, and then the booster is making it so that not only it's foundational, but it's actually, sorry.
Well,
I'm
man,
sorry.
you have your ringer on your phone is astounding. I like that.
I don't hear it unless it's like that anymore. The foundational, the foundation is really strengthened and actually becomes defensive with the booster. Am I making sense? The first two shots really establish that immunity.
Right.
And the booster is kind of making it into a Rambo
Okay, so
immunity.
frosting on the immunity cake.
Yes, and so with the Omicron variant that's coming, it's the shot works against it. We know a higher titer works even better against it. And so we're gonna hear more about boosters.
Right.
This is not any different than what we do with the flu shots, that we have to change the flu shots every year based on the variant that we have. And so we're gonna see that the shots are gonna change. Fortunately, I think we're really close to having a universal coronavirus vaccine, which means that regardless of the variant, they would be covered. And it also would cover other coronaviruses, which includes the common cold. So potentially, once the universal shot comes out, then there actually is going to be even more benefit beyond COVID.
And one of the other things that I had noticed in talking with you earlier this week too was that when it came down to the idea of getting a booster, myself and my wife have had the Moderna vaccine, both doses, and that second dose, frankly, just really kicked my butt for about 12 hours. And it
but
was,
praise God, you had an immune system.
yes,
yes.
Yeah, there's always positives. But I guess my biggest question was, man, do I have to go through that again with the booster? And your reassuring statement earlier this week was, it's not like that.
We have a large amount of hundreds of thousands of points of data that say that the booster is similar to the reaction somebody had with the first shot.
Which I didn't really notice anything from the first
And
shot.
most people did not have reaction with the first shot, maybe a sore arm.
One of the other questions that, and again, I'm just playing off of everything that we hear in the media and everything, is different blood types, it affects differently. Is that true from your perspective?
I'm not the scientist, research bench people, but they are looking at the different data that looks at blood types. But remember, blood types is part of a huge genetic array of things that are happening.
Right.
So it may not be the blood type, maybe the genetics that are behind the blood type.
Gotcha.
And the immune system effects of those genes.
You know, I guess I think back, to the stories of when the flu first made its big debut in the world, and how many millions of people died as a result. And this sounds an awful lot like we're really dealing with the same sort of thing, that we just got to get our medicines wrapped around what this the threat here, and then once we do, it'll be a lot more like just the common flu.
It's pretty exciting as to what they're doing in doing so quickly. We are finding out that the monoclonal antibodies that we've been using at the office are probably not going to be effective for more than a couple more weeks. I mean, they're effective in the body for a long time, but not effective against the Omicron.
Hmm.
And so they're going to start no longer producing it because it's not effective against the Omicron. There's a different monoclonal that is. The ones that we have now, they're going to have to kind of readjust to cover the variant better.
Mm-hmm.
So the pills that got approved yesterday, they're capsules that you take twice a day. It's a series of for 5 days, 3 tablets in the morning, 3 tablets at night. That can be given to patients within 5 days of the symptoms, not 5 days of testing. And Elsa, wouldn't you think that there's been confusion, because people think that day 1 is the day they got tested?
It's not, no.
So we have to count back to when the symptoms start.
Mm-hmm.
So when these capsules come out, and they believe that there's some of them may be out next week, we may not have access to them in person.
Right.
But some of them are going to be out next week. The key is that we're going to have patients test quickly, because we only have a 5-day window. And so they have to identify what their symptoms are, that this potentially could be COVID, test, and then get a hold of their doctor to get this medicine.
So the bottom line, don't screw around if you're having any kind of symptoms at all. Go get checked right away.
Yeah, and that's where the idea of having the home kits are important, so that the patients can check themselves at home quicker than waiting for an appointment the next day.
And where do people get those?
Right now, Walgreens, I believe, Safeway, maybe Walmart
really?
have them now. I think it's about $20 for 2.
Mm-hmm.
But the Rural Health Center and the Christian Clinic, we are to get a large shipment, and to begin to hand them out. I believe that the county will start handing them out in mass as well.
So this is just, we're just beginning to see this.
Yeah, it's really going to happen after New Year's.
Yeah, interesting.
Yeah.
And Man, I think one of the other things that just sticks out of my mind as a important part of what we're talking about here is as much of a challenge and kind of an overwhelming emotional thing as being, working in the medical field right now with all this COVID stuff is, and I'm using the word stuff in place of other ones, as, here's Allison, who you worked here last year and you decided to come, all of this was going on last year. And while I think some people could be overwhelmed, you decided, hey, this is where I want to be. And I know you have ultimate goals going into the Air Force and all that kind of stuff. But I think that says a lot about you.
Well, thank you.
Yeah, I have a lot of respect. The other day, I mentioned this earlier in the week, and I'll mention it again because I have a big mouth. When I was in the ER, and again, it was overwhelmed, there was a person in there who was delirious and quite vocal, and it had somebody in their family chain that had been a sailor at some point, and was very combative, and it was just, I was busy dealing with my own stuff, and I just kept hearing this lady, yelling, and the way that I would have been, wanting to just be very pointed in my comments, and I was actually suppressing making comments myself, but the staff there in the ER were doing an amazing job of being patient, and I could tell that, there's probably 150 other things they'd rather be doing right now, but the task was to take care of this person despite all the delirium and everything. That was really impressive. I kind of wanted to go slap this other person around a little bit, but their professionalism was outstanding, and I don't know. To me, I think that's something to be proud about with little old, Payson. It's not this, the huge medical centers down in Phoenix, but some pretty good work going on there.
From the standpoints of the students and the residents that we have trained up here who have been in other facilities, other training sites, and also just even from people that come from outside of the community, there's a recognition that Payson is, it's a unique place because we have highly skilled nurses and physicians and within our medical community, and we live here not because we couldn't get a job in an academic center or in Mayo or wherever. We live here because of our children,
right?
Because of our family. Many of us grew up rural and have a dedication that rural people deserve Beverly Hills medicine. And so that they're surprised that we're here. And again, the physicians and medical staff, we like each other. We work together well. That's unusual in a medical community. And because of that, we provide incredible medicine.
Outstanding. So what's the biggest misnomer or whatever you want to call it that people come in thinking that they understand about COVID-19 that perhaps they don't? Has there been any area like that where people come in with a bunch of misinformation?
I think so. A lot of people tell me they think it's just a cold or allergies,
right?
And we're proven wrong. But in regards to maybe the vaccine, there's some misnomers as well as testing. I've had patients ask me, well, what are you sticking up my nose? Isn't there like a chemical on there that's going to cause cancer and things like that? And
right.
I hadn't heard that, so I'm just not sure where that information's coming from. I don't think that's the case.
Right.
It's just a nasal swab.
It's cotton.
Yeah.
Well, if you're not allergic to cotton, it should be fine.
Pretty much.
Yeah. And how long does it take to get a result of a COVID test now?
The rapids that we're doing, for a positive result, it's pretty quick. Within 5 minutes, I know, usually. But if it's not showing positive, I'll usually wait the whole 10 to 15 minutes and just to make sure that it's negative.
Dr. Hunt, I think I possibly know the answer to this, but I want to find out for sure. If someone listening right now says, I got something bugging me, but man, I can't afford to go to the hospital right now. I don't have the bucks for that. I don't have the insurance and stuff like that. What do you suggest?
What I suggest is remembering that under the CARES Act, which people don't remember a whole lot, but that was the initial legislation that went through when we began to have the pandemic. Anything that is COVID related for the uninsured or the underinsured, they will not receive a bill. They may get the statements, but the CARES Act will cover anything that's a COVID related. So I mean that diagnosis code can't be going in with appendicitis and COVID.
Right.
The code has to be under COVID.
Right.
Then the CARES Act will cover any kind of treatment that needs to be done. So I don't want the uninsured or the underinsured to feel like they have to suffer at home because they're worried about the insurance.
Right.
That is kind of revolutionary in our country to know
Really?
that anything that is COVID related is going to be covered either by the insurance or the government is going to pick up the rest. We have the Christian Clinic that's available. Our phone number is 928-468-2209. We have a message machine that's on all the time. We actually answer the questions and every day. And then we can help arrange getting the monoclonal antibodies, get the testing, the monoclonal antibodies. We do testing at the Christian Clinic when we're open, so we are testing there as well. Arranging to get the monoclonals over with Allison over at Ponderosa. And you want to hear my favorite story?
Sure.
So we had a woman who works at the school and called and said, I think that I have COVID, can I come and get tested? I got sick last night, so we don't bring people into the office, and Allison's in my life right now is parking lot medicine.
Right.
And so we tested her. 30 minutes after her positive, she got the monoclonal antibodies. I don't think there's anywhere in the country that could do it that fast.
That is pretty impressive.
And she felt better in 12 hours.
Outstanding. So we're just about out of time. If anyone is exhibiting any kind of symptom, your tutelage would be to get yourself down, get tested right away.
Yes, get tested and then contact your doctor office, and they can make the referral over for the monoclonals. If they're part of Ponderosa, definitely call in and we can see what we can do. Obviously, we're coming up to Christmas holiday weekend.
Mm-hmm.
We do have monoclonals that, not a lot, but we do have some that we've saved for the weekend. So either through referrals from the ER or referrals from other doctors, we're going to try to get those in.
Outstanding. And again, if anything that we said here you'd like to hear again, you'll be able to see a recording of all this on our Facebook page at KRIM FM. And we appreciate both of you coming in. Allison, pleasure to meet you, and thank you for choosing to come back to Payson. That's I think it says something good about not only you, but about Payson. So thanks for that. And
Thanks for
Judy, it's
having
always a pleasure to have you in here.
Yep, just feels like home.
That's right.
Okay.
It's home with masks on.
Yes.
Anyway, we have to get you back to more of your favorite music. Have some tunes coming up from ELO, The Young Rascals, Survivor, and a whole bunch more. But first, a quick look at RIM Country weather.
The forecast for Payson and surrounding areas. I'm now
All right.
Just
Good job, Allison.
today.
Good job,
Very
you.
nice.
Skies,
Good
high
answers.
mid-50s.
Did we